My name is Nadia Chulias, and I am the President and Chair of the Board. Hello and welcome. My name is Nadia Chulias, and I am the President and Chair of the Board of the St. Martin Red Cross. Thank you for taking the time to tune in to our mini-series of our First Aid Save the Life campaign. The fact that you took some time out to watch means that you really care a whole lot about saving someone's life and even your own. For the first time ever on St. Martin, the St. Martin Red Cross will be showcasing a live production broadcast about first aid assistance and the importance of why it is an added value skill for your life. Whether it's a hurricane, a car accident, or a home emergency, you may be the one person to save your neighbor, a family member, or even a stranger's life. As a worldwide recognized first responder for first aid, we will be sharing valuable tips with some simple techniques that could be a difference between life and death for someone's existence. This is a limited series for the month of September and October, so do look out for the dates where you can tune in live on YouTube or Facebook, or you can register on the link below to participate in person in one of our live demonstration events. This is where you can also get it certified and receive a certificate from the American University of the Caribbean School of Medicine for their Stop the Bleed campaign. See you there.
Okay, good morning, everybody. Welcome to the Stop the Bleed certification course. My name is Bishoy, and I'm here on behalf of the American University of the Caribbean, called the School of Medicine. I'm a medical student there, and also working with the Disaster Medicine Interest Group there, and our faculty advisor, who could not be here today, Dr. Adelstein, as well as Dr. Humphrey, who is here today. She's our Dean of Community Engagement. And on behalf of all of us, we would like to thank the Red Cross for hosting this today and for hosting this today and for having us here and for working with us to help certify the community in Stop the Bleed. So Stop the Bleed is a course. There's going to be two portions to this. There's going to be this portion where we go through the PowerPoint, and then the next portion, you guys will actually be practicing with tourniquets. So it is a course that is provided by the American College of Surgeons, and it's made to help stop the bleed, teach how to stop the bleed. And so this is a special course because it is actually a collaboration between many different groups. So the Committee on Trauma from the American College of Surgeons, the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, and the Committee on Tactical Combat Casualty Care all came together and collaborated to create this course to teach in the most effective way how to stop a life-threatening bleed. Just as a disclaimer, some of the images that are shown in this presentation may be disturbing, so that's just a heads up for everybody here, just so that you're aware. And why do we need this training? Why do we provide this training? And why did all of these committees come together to create something like this? And that's because the number one cause of a preventable death after an injury or trauma is bleeding. And so that's a pretty big deal, right? Which means that if we can prevent that bleeding, that's also a big deal. And that's why this course is taught, and that's why we're all here today. Where can this training be used? So there's a lot of places. We may think that it's only in extreme cases, but if you think about it, bleeding can really occur anywhere. It can be the cause of anything. It can be at home. It can be at work. It can be on the road. It can be at your office. Anywhere that you can think of, there can be a cause of bleeding that occurs. At home, you are cooking, you're using a knife, something goes wrong, that can cause bleeding. On the road, if there's a car accident, or if, let's say, just you're out and about and there's a hurricane, and for any reason that causes some kind of injury or trauma, and that can cause bleeding. So really, we should keep in mind that this training, although we may think of it in extreme cases, for example, like a shooting, it really can be used in any situation where there's bleeding involved, and we need to stop that bleeding and prevent that death. So there are two goals to this. The first goal is identifying the bleed, right? So we can't stop a bleed if we don't know that a bleed is happening or if we don't know where it's happening. And so the first thing that we want to do is to recognize that there's bleeding going on and that, hey, this bleeding may be a threat to this person's life. The second thing that we need to do is to take the appropriate steps, which we'll go through, in order to stop the bleeding. And so this can, the three main forms that we're going to go through today are to put pressure on the wound, to pack the wound, and to use tourniquets. And we'll actually be providing you all with tourniquets at the end of this today. And you'll be practicing with these tourniquets to demonstrate that you are able to use them in a life-threatening situation to stop the bleed. Before we go through that, we have to talk about your personal safety. So in any situation, your personal safety has to be your first priority. And that may seem counterintuitive because you're trying to do this selfless thing and you're trying to help stop a potentially life-threatening bleed on someone. But if you're injured, if you put yourself in harm's way and you end up injured, that can actually do more harm because then you will not be able to help others and now you are also injured. So you have to make sure that you're only helping when it is safe to do so. And if at any point it is no longer safe, you have to stop, you have to move to safety, and then if you can, bring that person with you and then help them there in a safe location. So for example, if there's a hurricane going on outside, you can't just be out in the middle of the street, or if there's a car accident, you can't be out in the middle of the street helping someone and putting yourself in harm's way of being hit by a car, and you can't put yourself in harm's way of being affected by a potential storm that's occurring outside, right? So we have to move to safety first, and if it's possible, you want to move that person who may be injured with you, and then you can help them in a safe location, whether that's indoors, whether that's off to the side of the road where there are no cars, whatever that may be. What that also means is that you want to protect yourself medically in every way that you can. So if you have gloves available, you want to wear the gloves. And if you get blood on you at any point, because remember, we're trying to stop the bleed, and in the haste of the situation, you may end up getting blood on you. If you do get the blood on you, you want to make sure that as soon as the situation is over, once help has arrived and you are now cleared of helping, you want to clean any body part that the blood touched, whether that means washing your hands, taking a full shower, cleaning the clothes that you were wearing, whatever that means, you want to clean up as best as possible. And then you also want to talk to your doctor about the fact that you were exposed to blood so that they can direct you as to what to do best, and then they can make sure that you're safe. Because again, that is a priority even in helping other people. And you also want to avoid any contact. So if you do have to get blood on yourself, you want to avoid any contact with your eyes, with your mouth, and avoid spreading it to your own, like if you get blood on your hands, you want to avoid spreading it to your arms or your legs as much as you can. So now we're going to talk about the ABCs of controlling bleeding. So the A is alert, the B is the bleeding, and the C is to compress. Now, I just want to let you know that throughout this PowerPoint, it's going to say 911, and that's because this was created in America where the emergency service number is 911. Keep in mind that here on St. Martin, the number for an emergency medical service is 912. So you're going to keep seeing 911. I'm going to bring it up every time that it should actually be 912, but just keep in mind that if you're ever in a situation where you find that you are in need of emergency medical services, the number here is 912. So we'll talk about that first, alerting, and that's the A again. So you want to call 912, and you want to make sure that you're aware of your surrounding. You want to know where you are so that you can help them know where you are so that they can send the appropriate help to you. Because what help is it if they can't figure out where you are and they can't send the help to the proper location? That doesn't help, right? And then you want to follow whatever instructions that operator gives you. And if possible, you want to stay on the line with them until help arrives. You want to keep them updated on the situation. And if you're with more than one person, then one of you can be doing the next steps that we'll talk about and helping to stop the bleed, and the other person can be on the phone with emergency medical services or the operator and letting them know what's going on. You want to give them as much information as possible. Where are you? Again, big one. When did it occur? Are there any ongoing threats? Is there any danger to you or this person still, or to the general public still happening as you are talking to them? You want to let them know as much as you possibly can so that they can help you in the best way possible. So now the B. The B is for the bleeding, right? And the first thing we want to do is to find where bleeding is happening, because we can't help stop the bleed if we don't know where the bleed is occurring. So you want to look for the blood. You want to look to see if there's continuous bleeding. Is it still going? Is it not stopping? You want to check to see if there's a lot of blood that's being lost. And you can see that in a few different ways. You can see that, again, if you can see continuous bleeding, you can see that if it's stained their clothes, and you can just tell that there's so much blood that has seeped into their clothing that it's really soaked. And you can also see a pool of blood around them, right? And you'll be able to see that maybe the person is lying there and that around them is a pool of blood. And that way, that'll tell you that, hey, this person is bleeding, they're losing a lot of blood, and now you need to assess, where is this bleed coming from? So a few things to keep in mind about that. There may be multiple places where they're bleeding from. So just because you found one source of bleeding, that may not mean that you found every source of bleeding. Injuries can happen in more than one area. Something else to keep in mind is that if it's a gunshot wound and it's entered in one place, keep in mind that it may have exited on the other side of that body part, whether that be the arm or the torso, on their body, their leg. So you want to check to see if there is another source of bleeding, because you may stop the bleeding on one side, but if you can't stop the bleeding on the other side, they're still going to be losing blood. And you want to continue to look. You want to make sure that you found every potential source of bleeding and to help stop every single one. Also keep in mind that clothing, if they're wearing especially heavy layers or a jacket or long pants or shoes, whatever it may be, that can hide the bleeding. You may not be able to see it. So we said before that clothing may help you find the bleeding, but it could also hide the bleeding, especially if they're wearing dark clothing or, like I said, something that's thicker or longer. And that way you want to make sure that you are looking, you are like rolling up sleeves, taking off a jacket, taking off shoes, or rolling up pants, whatever it may be, to help you look and find where the source of the bleed is. And it can occur in multiple different places, like we said. So it can be in the arms, the legs, it can be in the neck or your armpit or the groin area. And keep in mind, in these areas especially, there are some really big blood vessels there, which means that if there's bleeding occurring in one of these areas, they're most likely going to be losing a lot of blood, and that may be a more serious bleed than if it was, say, in your arms and legs. But any bleeding can be life-threatening, so just keep that in mind. And then obviously it can also just be on their body, on their torso. And so now we're going to talk about the C of bleeding. And this is to compress. You want to put pressure. There's going to be a lot of pressure involved in stopping bleeding. And the way that you do this, you want to apply a direct pressure on the wound. You don't want to apply around it. You don't want to apply behind it. You don't want to apply above or beneath when you're compressing. We'll talk about when you want to apply above, but for now, if you're just compressing directly, you want to put it directly onto the wound. And so you want to find the source of that bleeding, and we'll see a demonstration of this in a minute. You want to find the source of the bleeding, and you want to compress right above that wound. You want to use just enough gauze or cloth, or if you have a shirt available, whatever you have, you want to use just enough to cover that site of where the bleeding is. If you use too much, then you're going to be putting pressure, and instead of the pressure pressing on the bleed, it's going to just press on whatever cloth you have there or the gauze or whatever, and that pressure will now become invalid. Like it will not work. It's going to not help stop the bleed. So you want to use just enough, and if the bleeding stops, you don't want to stop putting pressure on. You have to continue putting pressure on until emergency medical services arrives, or whoever it may be, and they can relieve you of helping, and then they can figure it out from there. But if the bleeding stops, you don't want to stop putting pressure on, because the bleeding can start up again. So here is that demonstration I was talking about. We're going to see an example So this is a dummy. There's an example of what a wound may look like there. So you want to identify that first. You want to take whatever you have. Notice how she's not like crumbling the entire shirt and putting it on there. And then look at how much pressure is being used. You have to use quite a bit of pressure in order to effectively stop a bleed. So that's something that to keep in mind, that you want to use a lot of pressure. It may hurt. It probably will hurt. This is an open wound. This is someone who has trauma or some kind of injury. But keep in mind that this is what's important. You want to use that much pressure so that you can effectively stop the bleed and save this person's life. On top of compressing, you may need to pack. Something to keep in mind with packing is you want to use something sterile. So what packing is used for is if it's a larger wound. It may be too large of a wound where compression alone is not going to help. And in that case, you want to take something sterile, like gauze, for example, and we'll talk at the end about where you could potentially purchase kits that have gauze in them. But you want to use something sterile, again, like gauze, and you want to pack the wound. And the effective way to pack the wound is to pack towards wherever the heart is. And that's because if I have a wound on my arm and I'm losing blood, my blood is pumping from my heart to my arm. And if I pack straight, it may continue to bleed on top of that, whatever I've packed on there. If I pack downwards, and we'll see an example of this, the same way we saw an example of the compression, if I pack downwards, I'm packing away from where the blood is coming from, and the blood will still be able to come out. So I have to pack upwards towards the heart from wherever the wound is. If it's on their leg, you want to pack upwards towards where the blood is coming from in order to help stop the bleed as effectively as possible. And remember, this is used for something that may be a deeper wound, a bigger wound, something where just compression alone is not going to be effective enough to stop the bleed. And so here's an example of that. We're seeing the same dummy again, but it's going to be on a different wound this time. And notice how she takes out the sterile gauze, and she's going to start packing. And this time we're trying to use a lot, right? It's not the same as the compression because here a lot is going to be effective. You want to pack it as tightly as possible. You want to stop the bleed as effectively as possible, right? And this is a big wound, so you want to pack as much as it takes in order to stop the bleed. And at the end, notice how you're still going to compress, but you're going to pack first, and then you're going to compress. And again, notice how much pressure is being used here. This is a lot of pressure. You are trying to stop bleeding, and in order to do that as effectively as possible, you need to use as much pressure as you can. And this can be done with your arms, as is being shown. If there's multiple sites of bleeding, you can use, for example, your knee to kneel on the side of the wound once you've put something on there. Whatever it takes to get that pressure to stop that bleed. Again, remember, the whole goal here is to stop the bleeding, and pressure and packing are going to be two of the most effective ways to potentially do that. And again, keep in mind that this can happen anywhere: the arms, the legs, the neck, armpits, your groin, or on your body anywhere. These are all areas where the bleeding can happen, and if it's a bigger wound, then you want to pack and then compress and not just compress. The third way that we're going to talk about, and this is the way that we'll be practicing at the end, is by using a tourniquet. And we'll see some examples of tourniquets. You guys will all get tourniquets at the end. The important thing to keep in mind about the tourniquet is that you want to apply it 2 to 3 inches above where the wound is. Okay, so you want to find the site of the bleeding, and this is the case where you want to apply above the wound. So here you're not going to put the tourniquet directly on the wound, because then the blood vessel above the wound can still pump blood and it can still get out. But here you want to go just above, about 2 to 3 inches above. And something important to keep in mind is that you don't ever want to place it on a joint or an area with a lot of bone, because that way you're just going to be compressing the bone and you won't actually be able to compress the blood vessel properly. So don't ever place it above an elbow or a knee. You want to place it like on the forearm or on the arm, but not on the elbow. Same thing, you would maybe put it on the thigh or the leg, but not on the knee and not like on the ankle joint. Something else to keep in mind is you would never put a tourniquet on someone's neck. And that may seem just like common sense, but in the frenzy of things, we sometimes are rushed. We don't think about how to properly do things. And that's just something to keep in mind, that if there's ever a bleed in that area, we would never put a tourniquet there. And something else to keep in mind is, just like we said with the compression and with the packing, if it stops bleeding, you don't want to take it off. You want to leave it there and leave it to be figured out by emergency medical services once they've arrived. So you want to place it 2 to 3 inches above, and you want to tighten it as much as possible, and then you want to leave it on there until someone can remove it. You can apply a tourniquet to yourself, and you may get to practice that today. It can be applied over clothes, but keep in mind that this really only applies to light clothing, so like a shirt or some light pants. But if someone's wearing like a bulky jacket or some really heavy pants or something, it's going to be really ineffective to use a tourniquet over that, and so you would want to remove like a jacket first. But if it's just a shirt, a light shirt or something like that, that's totally fine. The tourniquet will work on that. You want to keep in mind, again, there's a lot of pressure involved here. It's going to be really tight, and you'll see that today. These will hurt, and the person that you're trying to help may complain that they do hurt. But again, the point is to stop the bleeding and save the life, and that's more important than the fact that they may be in pain. And they're probably already in pain from whatever trauma occurred that's causing this bleeding in the first place. And sometimes you also may need a second tourniquet in order to help stop the bleed. So that's just something to keep in mind, that you may need to use 2 in order to stop it. So here's an example of how to use a tourniquet. And this is what we'll all practice today. And so it's going to be wrapped around, remember, 2 to 3 inches above where the wound would be. And then you're going to loop it through, and you're going to tighten. Again, remember, this is going to be really tight. It's going to hurt. You're going to tighten it, and then you're going to use that little rod there. You're going to twist, and that's going to tighten it even more. And then once you've twisted it, about 2 to 3 times is the goal. That's where you'll snap the rod into that little latch there, and then you will continue to just tighten. And then what you'll see next here is that little strap is going to be placed over it, and it's normally white colored. And then the reason for that is that you want to write on it. If you have something available with you, you want to write what time you place the tourniquet on there. That's going to help emergency medical services with their evaluation and with helping this patient after you've done that. And so you want to make sure that either, if you can, write the time onto the tourniquet, and if you can't, at the very least, document what time that you place the tourniquet onto the patient so that you can let them know and they can figure it out. These are just some examples of tourniquets. There are different kinds. There are the tactical tourniquets, like the ones that you saw and the ones that we'll be using. There are some other, so these are non-pneumatic ones. There are mechanical ones. There's ratchet ones. And then there are also pneumatic tourniquets. So this will be something that would be, you would use gas or air to blow it up, kind of like a blood pressure cuff, but just to stop the bleed instead. And then keep in mind for children that in pretty much all children, unless they're really, really young and small, the same methods can be used. So you can still compress the same way, pack the same way, use the tourniquet the same way. And that will work in pretty much every case, unless they're a very small child. In that case, the tourniquet may be too big and it may not fit. And in a case like that, if it's a really young child and they have a source of bleeding, you just want to pack and compress, mostly compress as much as you can in order to help stop the bleed in that child, because you won't be able to use a tourniquet if it's too big and it won't tighten around their arm or leg, for example. So some commonly asked questions within this presentation. What if there's an impaled object, a knife, a branch, anything that's stuck in a limb or in the body? What about improvised tourniquets? So if you don't have an official tourniquet, the loss of an arm or leg, some patients may be worried about that, or anybody that you may help. Now you're placing a tourniquet on them and you're constricting their blood flow to that limb. What's What about losing an arm or a leg? And then what about the pain? So with an impaled object, you want to leave that in there. It may seem like first nature to just want to take it out, but you want to leave it in there and you want to let emergency medical services deal with it. Keep in mind that an improvised tourniquet, so anything that you may have, like just wrapping a shirt around or whatever, they may not be as effective. So you want to use an official tourniquet if possible. So the one that we'll give you today, maybe keep it in your car, a backpack, a purse, whatever that may be, whatever you feel like is most effective for you. But keep in mind that if it's possible, you want to use that. If someone is asking about losing an arm or a leg, you want to remind them that the reason that you're doing this, the reason you're placing a tourniquet and doing it so tightly, is to stop a bleed that could end their life. Remember, that's the #1 preventable cause of death after a trauma or injury. And so the benefits of that are definitely going to outweigh the risks of potentially losing that arm or that leg, right? And so you just want to remind them of that I'm just trying to save your life and to avoid you losing your life over you losing an arm or a leg. Again, it's going to hurt, but you want to remind them, this is to save your life, and that's more important right now than the pain that you may be feeling. So just a quick summary. Remember to assess for safety, make sure that you are safe. If it's unsafe, you want to move to safety first. Then the ABCs, right? So first, alert. That would be calling 912 and letting them know something has happened and where you are. Then the B, you want to find the bleeding, find any sources, multiple sources, whatever it may be. And then C, you want to compress, either with pressure, a lot of pressure, or if need be, if it's a larger wound, with packing, or if you have one available to you, using a tourniquet. And then you want to stay there and you want to wait for help to arrive. Don't take anything out, don't stop the compression, don't take the tourniquet off, don't unpack a wound. Even if it stops bleeding, you want to keep compressing, keep the tourniquet on, whatever it may be, until help arrives, and you want to wait there with the person until the help arrives and they can take care of them instead of you. And for any more information, you can go to stopthebleed.org. There's a lot of information on that website. It's frequently updated by the American College of Surgeons. And anything that may be new within this program or within Stopping the Bleed, they update that on their website. There's also Stop the Bleed kits that you can buy on there. And you can go on their website and order a kit that has gauze, it has gloves, it has a tourniquet, whatever you may need or want. You can also order just tourniquets on there. And you can keep that with you in the case that you ever may need to use it. And we'll leave off with this. The only thing more tragic than a death is a death that could have been prevented, right? And so that's the whole point of this, is to prevent something that is preventable. We can stop a death from bleeding if we know how to, and that's the whole point of this course. And now we'll switch over, actually, and we'll do first aid and CPR. And then after that, we're going to hand out tourniquets to everybody, and you're going to practice how to stop the bleed, and you're going to demonstrate that you understand what we've talked about today and that you are able to use the tourniquet. And then everybody will be issued a certificate, Stop the Bleed certificate, once we've verified that you can place a tourniquet. And you can pick these up here on Tuesday. But we'll talk about that more after, and now we'll transition over to first aid and CPR. Thank you.
Good morning to each and every one of you. Today we're going to continue with our second episode. My name is Meredith Concepcion, and I am a European certified Red Cross First Aid instructor. Last week we focused on safety, how to evaluate the victim condition, how to check for breathing, how to alert the emergency services, and when to put a victim into recovery position. Our victim was unconscious, breathing, with no other life-threatening conditions. This victim was then placed into a recovery position. We do hope that you all had practiced at home so that you know exactly how to place a victim in a recovery position. Today, we will focus on a victim that is unconscious and not breathing, and this person is showing no signs of life. When a person is unconscious, unresponsive, and showing no signs of life, we start immediately with CPR. What is CPR? CPR means cardiopulmonary resuscitation. Cardio is heart, pulmonary from the lungs, and resuscitation is pumping of oxygen-rich blood through the body with chest compression and breathing. Doing CPR can limit damage to the organs such as the heart and the brain, and the victim has a greater chance of survival if you immediately start with chest compression and breathing. What's the difference between heart attack and cardiac arrest? Because most of us sometimes we get confused between what is heart attack and what is cardiac arrest. So we must know the difference between the two. Heart attack is a circulation problem. The blood vessel of the heart has been blocked, and this is often by a blood clot. Cardiac arrest is an electrical problem that can be triggered by a disruption of the heart rhythm. With cardiac arrest, the electrical signals in your heart has gone wrong. Your heart rate is disrupted. Blood and oxygen no longer circulate through your blood. Heart stop working and need to be restarted. Person is unconscious. So I just gave you the sequence of what you can look for when there's a heart attack, cardiac arrest. With heart attack, the heart continues to beat, but because of the blockage, it is not receiving enough oxygen, rich blood it requires. The person is conscious, but during heart attack, not everyone has the same symptoms. Symptoms differ from chest pain that can spread from the jaw, the back to the jaw, the back, and the arm, the shortness of breath, restlessness in some person, anxiety, an abnormal heart rhythm, etc., etc. Our victim today is unconscious, unresponsive, and showing no signs of life. I will demonstrate how to perform CPR, but to perform CPR effectively, you must know the following steps, which is very important, because if you don't do the step good, you will not be performing CPR effectively. We are determining that the scene is safe, the victim situation has been evaluated, and we will take this step by step. We will demonstrate step by step. Okay? Okay. Make sure the victim is lying on his back on a firm surface, because you cannot give CPR on a bed because it's too soft, so you would not be giving good compression. Go in the back of the door. Right? You kneel in front of the dog in the victim, comfortable position. You put one hand, heel of one hand in the center of the chest. In the center of the chest, one hand. The other hand on top of your hand that is on the chest. You interlace your fingers. You lock your elbow. Position your shoulders over your hand. So you want to go over the shoulders. Goes over the hand. And when we are in that position, we want to give, let me just check to see if the positioning directly in the center of the chest. A little bit higher. In the center of the chest, yes? You need to make sure that you have the correct position. Once you have the correct position, you give 30 compression. You want to push hard and you want to push fast. Press down 2 inches deep, about 5 to 6 centimeters at a rate of 100 to 100 compression per minute. You have to maintain a steady rhythm. If you don't apply enough compression, you will not be able to do exactly what you need to do to be able to for the victim to survive. So what we're gonna do right now, we're gonna do the 30 compression so that we can see, so that everyone can see how we are doing that. What we want to do as well, we want to avoid, when given compression, avoid lifting our hands from the chest of the victim and allow the chest to fully rise between compressions. So we can go 30 compression, yes? 1, 2, 3, 4. Good. High quality chest compressions are the most important part of CPR and have the biggest impact of survival of cardiac arrest. After the 30 compression, we will then give 2 breaths. When giving breaths, we open the airway by a head tilt and chin lift. Head tilt, chin lift. You use your 2 fingers on the bony part of the chin and you lift the chin. Secondly, you want to pinch the nose, close the nose, and you give 2 breaths. Breath and breath. Rescue breathing can be provided through the mouth-to-mouth method. You can do a mouth-to-barrier method. We have the mask here that you can see, that you could put it over the mouth of the victim, and then you can give breath in this. Yeah? Each breath should be given over 1 second with sufficient volume to produce a visible chest rise. If the air does not go in properly, what do? We retilt the head, open the airway, and we breathe and we give breath. What we want to do, we want to seal the mouth properly with our resuscitation mask. These are the steps for adults and a child CPR. The step for infants, they are slightly different. We are encouraging you to sign up with the Red Cross to get more information on how to perform CPR on an infant, because their steps are slightly different. We're going to give 30 compression again. Position your arms. Good. Start. 1, 2, 3. Remember, 2 inches deep. Good. When do we stop at CPR? When the ambulance arrives and tell you to stop. You don't stop before the ambulance personnel tell you to stop and they take over. When someone else that is trained besides the ambulance take over, that they come and help you and take over. When you are extremely tired to continue, because if you're not given, like I said in the beginning, effective CPR, then nothing happens. So it's important that if you are extremely tired, then you can stop. And when person regain consciousness, they stop as well. You stop as well. When should you not resuscitate someone? If your life is in danger, you do not go in to resuscitate, or if this person is a DNR bracelet or a necklace, do not resuscitate. Then you do not resuscitate. Good. Once the ambulance arrives, we have it's a training AD. The host could hold it up. Training AD. And the AD analyzes the heart rhythm. It sends electrical shock to the heart. It's attempt to restore the normal rhythm. AED are designed to be simple so that everyone may use it. So when you open the AED kit, it would give you the instruction. Once you press the on button, it would give you all the instructions, what you need to do when it arrives. So you place the pads on the, put it next to you, on the victim. It's got it in the middle. Mm-hmm. Yeah.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest. Don't touch patient. Analyze it.
Touch.
Don't touch patient. Analyze it.
Everyone, don't touch patients. Analyzing.
Shock advice.
Shock device.
Don't touch patient. Press flashing shock button.
Press the red button.
Shock delivered. Start CPR.
Okay, that's it. CPR, the AED machine is very, very easy to work. So, stop it, please.
Stay calm. Check response.
So we are encouraging you to sign up for this training. You should make a difference in a person's life. You are the difference between life and death by learning simple techniques on how to save lives. Be a difference. Sign up at the Red Cross building and help save lives. Thank you.
Okay, so now we will be returning to the second part of the Stop the Bleed course, where we're going to do a quick live demonstration first, and then everybody will be practicing. You can practice on each other if you're comfortable doing that, or if you're more comfortable practicing on yourself, then that's also okay. And you just need to demonstrate that you can place a tourniquet effectively in order to earn the certificate for Stop the Bleed. So first, we're going to start with that live demonstration, like I said. So two of my colleagues, also from the American University of the Caribbean and from the Disaster Medicine Interest Group, Edgar and Elizabeth, as well as a volunteer from the audience, Noah, will be helping us demonstrate how to place a tourniquet properly. So Noah, do you want to come up? And so remember, this is just how to place the tourniquet, but we still want to keep in mind all those steps: assessing, alerting 911, finding the bleeding, and all that. Once you've done that, then we're going to proceed with placing the tourniquet. And so let's say that Edgar will be the person that Noah is using to place the tourniquet. Let's say that Edgar had a bleed on his arm. And so Noah would want to place that tourniquet above the bleed on his arm. And so do you want to go ahead and, Noah, do you want to go ahead and place the tourniquet on Edgar's arm? And demonstrate for us how we do that. And so you would want to unwrap it first. And then he's going to place it around his arm, as you can see. He's going to loop it through, and he's going to tighten it. Remember, there's a lot of pressure that comes with stopping bleeding. And then he's going to turn the rod. That's going to help tighten it. For today's purposes, since we're just practicing and nobody's actually stopping any bleeding, don't have to tighten it all the way and cause pain for no reason. But remember that in a real life situation, you want to tighten it as much as possible in order to effectively stop that bleed. Notice how he placed the rod into the loop, and then he placed that seal over. And remember, if we had a marker with us, we would want to write the time on there in order to be able to assess further. But this is to demonstrate to you that stopping the bleed can be so easy that even a 12-year-old can do it, and do it effectively too. So anybody can stop the bleed anywhere, anytime. And now we're going to transition to you guys practicing. So thank you to Edgar, Elizabeth, and to Noah, and for helping us demonstrate that. And now we'll be transitioning to you guys practicing. So if everyone could unravel their tourniquets. And then again, remember, you can practice on each other, or you can practice on yourselves if you would prefer that. And if you have any questions at any point, feel free to ask. So remember, you want to twist it first, and that's going to help make it tighter. Okay. Yeah, so just remember that, so before you would place this on, right, you would want to tighten this as much as possible.
Yes, I told him.
Okay, yeah. Okay, perfect. And then you want to twist it 2 to 3. Perfect. Yeah, perfect. Yep, awesome. Perfect.
You're getting nervous.
Perfect.
Go back and
Have the camera.
The mic, I have it.
You're on. It was on.
I think that was how it was supposed to be. I'm so sorry. Yeah. That doesn't interfere with all. I mean, the tourniquet is a one use, or do you have to use it all the time?
I mean, it's probably going to end up being the one use because what's most likely going to happen is you're going to place the tourniquet, EMS is going to get there, and they're going to take the patient with the tourniquet, right? And you're probably not going to stop them to take it back. So, and then you're also probably going to get blood on it. And so, more likely than not, it would be a one use.
Okay. So this is for trained medical officers.
No,
You,
this
not and
is
for me.
yeah, exactly. And the point of this training is to teach you how to use it, and then certify you so that you can use it.
You're gonna get a certificate. I understand that, but like, let's say, for instance, as a family, you're going. Okay, so I'm trained right now, but I don't walk with a tourniquet or anything like that. In your truck, and it should be. You're going to the grocery supermarket, for instance, and something happens.
Yeah. So then you want to use whatever
If you don't have this,
So remember, you would want to compress, right? But if, at the very least, you want to put pressure onto the wound, right? You want to try to stop the bleeding with whatever you have. So if that, for example, if it's on their leg and they're tight and they're laid down on the ground, if the best way for you personally to put pressure than you is to like kneel on them. Sorry. So you could use your knee for pressure if that's the easiest way for you. You could use your hands like we showed, or your elbow. You could lean on it if you're starting to get tired, whatever that may be. But you want to put pressure. If you happen to have gauze with you or something sterile, then you can pack the wound. And then if you have the tourniquet with you, then you can use that. Remember that like that's the best way to stop the bleed. But if you don't have a tourniquet with you, then you just want to try whatever you can to help stop. And that would be the best way to pressure.
Hi, sure. So, like I said, you're not in an area where you have your gauze or your tourniquet, and
My
you
name
need to
is
stop
Nadia Shulias, and
you need to stop the bleeding. And it has to be something sterile, okay, the gauze for instance, but if you have a cloth, it's not sterile, can you still use that?
So
Because I know that's going to be putting bacteria into that.
So for the sterile is mostly to
my name is Nadia Shulias, and I am the president and chair of the board of the Samaritan Red Cross. Thank you for taking the time to tune in to our mini-series of our First Aid Save the Life campaign. The fact that you took some time out to watch means that you really care a whole lot about saving someone's life and even your own. For the first time ever on St. Martin, the St. Martin Red Cross will be showcasing a live production broadcast about first aid assistant and the importance of why it is an added value skill for your life. Whether it's a hurricane, a car accident, or a home emergency, you may be the one person to save your neighbor, a family member, or even a stranger's life. As a worldwide recognized first responder for first aid, we will be sharing valuable tips with some simple techniques that could be a difference between life and death for someone's existence. This is a limited series for the month of September and October, so do look out for the dates where you can tune in live on YouTube or Facebook, or you can register on the link below to participate in person in one of our live demonstration events. This is where you can also get it certified and receive a certificate from the American University of the Caribbean School of Medicine for their Stop the Bleed campaign.
Good morning, everyone. We would like to thank our online viewers and our participants here at Red Cross in Simpson Bay, Red Cross St. Martin. We thank you for your participation, and this was episode 2. I hope it was exciting. You've learned a lot, and you want to learn more. So if that is the case, keep following us on Facebook and also at our Red Cross St. Martin website for more information on joining and starting your course on becoming a first aid responder. Our next
You okay? You okay?
Is she okay? Is she okay?
See?
Is she responding?
No response.
Shows a pulse.
You check
Ringing.
the breath.
Any help? Somebody call ambulance?
Call for help. Bring the AD, somebody.
AD has arrived.
AD had it right.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach decent
Help, please.
pads to
Help.
patient's bare chest.
Help, please.
Attach defib pads to patient's bare chest. Don't touch patient. Analyze it.
Everyone stand clear.
Clear.
Don't touch patient. Analyze it. Shock advised. Don't touch patient. Press flashing shock button.
Everyone stand clear.
Shock delivered. Start CPR.
All right.
you. This, hello? You see what can happen? This is reality. This is reality. We have to be prepared. So follow us. Follow us on Facebook. Join us. Become a first aid responder. Thank you very much, AUC. We want to thank you for your participation and showing and certifying our participants. For the next time, persons that joined us online, come to our live event and get certified as well. Thank you very much. Have a good morning and have a great weekend. I hit my head.